Over the years, we have highlighted the struggles faced by residents in island and mountainous areas in accessing healthcare services. Health workers too continue to endure difficult conditions to reach these communities, moving through muddy terrain, crossing water bodies, and in some cases, climbing steep slopes just to deliver care. Kabong district in the Karamoja sub-region is among the hardest hit when it comes to poor healthcare service delivery. The district, with a population of over 264,000 people, relies on just 23 health facilities. Of these, 15 are Health Centre 2s, 7 are Health Centre 3s, there is no Health Centre 4, and only one hospital serves the entire district.
So the data highlights a shortage of health workers in some of the districts. And the highest vacancy rates, as mentioned, they are observed in Kabong. Now, with a vacancy rate of 46.6%, close to 50%. We have Namisindwa with a vacancy rate of 39%.
Due to the limited number of facilities, many residents are unable to access essential health services. Earlier this year, we reported on communities living on Mount Morungole in Kabong district, where access to health care remains a major challenge. Residents in villages surrounding the mountain often fail to access treatment due to the absence of nearby health facilities, forcing many to rely on traditional medicine. The Commission's findings mirror the situation on the ground.
The only health center there was a Health Centre 2. It was operated by one nurse. To make matters worse, it is a Health Centre 2 operated by one nurse who was actually the only person working in that health facility at that time. She mentioned that she handles about 8 to 10 deliveries in a month, and this is a lot for one person. She mentioned that she handles extra illnesses that are not supposed to be handled at a level of Health Centre 2.
The study covered several other districts including Kasese, Chisoro, Mbale, Bulambuli, Sironko, Bududa, Kapchora, Buvuma, Kalangala and Namisindwa, which all face similar challenges. In Buvuma district, for instance, patient transport remains a concern as they struggle to sail to facilities to get care. Although the Ministry of Health introduced a boat ambulance service, the Commission says that many residents cannot afford the fuel required to operate it. In most cases, patients and their caregivers are forced to meet these costs themselves, yet many cannot afford.
You find that for a single trip, one has to spend around 300,000 shillings. Now imagine you have to go to the mainland, and then when you heal, you have to come back home. So that is a trip of about 600,000.
Even after crossing from the islands to the mainland, patients still face another hurdle accessing road ambulances to reach referral facilities. Most of the patients end up using border borders to transport patients, an option that is risky, especially for pregnant mothers and critically ill patients.
Now, in some of the districts we visited, the ambulances were provided by the members of parliament, but when some of our members of parliament do not go through the next term, they withdraw their ambulance.
Yet amidst this, some districts lack substantive district health officers, while others are operating under acting officials, creating gaps in supervision and service delivery. The Ministry of Health has acknowledged the challenges and says there is need for tailored planning for hard-to-reach areas such as islands and mountainous regions.
There is need for us to plan with that lens that this is an island. We are saying that each sub-county should have a Health Centre 3, but is this applicable to an island place which has 4 or 5 islands in one sub-county?
Nobat Atkunda, NTV News.